All right. Give me 1 second. All right, we are live, so I will call the Greater Boroughs Partnership for Health Advisory Board meeting to order. It is Tuesday, June 11th at 10 a.m. And we'll just do a quick roll call. So Westboro,
Ken Sullivan, present.
Boylston,
Anne Marie Muckenstrom, present.
and Southborough,
Chelsea Malinowski, present.
and Northborough, Isabella Caruso, present. So thank you all for meeting today. We'll first get started. Actually, Taylor, can you share those slides? Taylor's going to help me out, be my wing person today.
First, we should congratulate you on your new position.
Thank you. So that is the first update. So as many of you know, I formally accepted the role as Health and Human Service Director for Northborough. I'm super excited, but that does mean that we have some positions open for the Greater Boroughs Partnership for Health, which will be reflected in the FY 2025 budget. So these are the three positions. So shared service coordinator, a regional public health nurse, and then a regional epidemiologist part-time. So those are the three positions that will be backfilling, starting really as soon as we can. Northborough can kind of get our stuff together because we're also hiring a social worker and an outreach coordinator. Does anyone have any questions about these roles?
Isabella, just process-wise, are these posted as Northborough positions when we post them? And do we have all of these positions in your personnel plan already?
Yes, so personnel has already voted on all of these positions, and they'll be modeled after me and Michael's old position description. So it was a town of Northborough employee, but there's verbiage about Greater Boroughs Partnership for Health. And then the shared service coordinator, I'll have to refer back to our almost new IMA about who needs to be on those committees, and we can talk about that moving forward because we obviously want the advisory board to have a voice on these shared positions.
Thank you.
Any other questions about these shared positions? All right, Taylor, next slide. All right, so the IMA, so we're kind of 2-3 weeks away from our IMA being expired, and we've done a lot of work to get this process moving. So as you can see in this kind of little spreadsheet, so Southborough, congrats, you win. You got the IMA approved. Westboro and Northborough, we're just waiting on our Board of Health, which you can see those dates listed. And then Anne Marie, I've been kind of going back and forth with Sarah, but do you guys have dates for your select board and Board of Health where you're going to be speaking about the IMA and voting and signing?
Can you hear me?
Yes.
Oh no, I lost you. Oh, you can hear me?
Yep.
So June 24th, we have our meeting, Board of Health at 6 p.m. So unfortunately, we can't do anything until then because this meeting was in between our meetings from May to June.
Okay, so on June 24th, your Board of Health will meet and discuss this and vote?
Correct.
And what about your
And the whole. So that I did not get a response back yet. Sarah's not feeling well, so I didn't really want to bother her yesterday. I know she had reached out, but I haven't got an answer on the Board of Selectmen yet. But if by end of business day today, if you want, I can try to find out and I'll send you an email.
Okay, that would be really helpful just because we're, just a couple weeks away and we need to have a active IMA.
That's fine. I'll make sure I get it to you today.
Isabella, can I ask a question about process? So do you want us to go ahead and start getting what signatures on this? And how do you want to coordinate I just want to make sure that we get, even though everybody votes, that we get the signatures in time. So how do you
So I
want?
guess for Northborough, we have one IMA, one signature form that Northborough or Board of Health and Select Board has signed. And then we can just compile those 4 documents.
Okay,
4
so
pages,
am I good to go ahead and get the signatures and get them off? I just, you know, if there's any changes, I think we just need to look at them, but I just want to make sure.
Yeah, I think at this point, there can be
Okay.
no changes really, you know, unless there's large things that we've missed, but so many people have looked at it, all town councils, most select boards and Board of Health.
Okay.
So obviously if there's a huge issue, let me know as soon as possible and I can get Rich to look at the suggestions or edits.
It's not going to come from Southborough. Southborough, I think, had
Yeah.
that.
So if you want to just get that paper signed,
Sure.
then I can pick that up or we
Okay.
can facilitate that.
Okay,
And
I'll get that
same
done this
for
week.
Jen. Yeah,
Thank you.
perfect. Any other questions about the IMA? And Anne Marie, if it's necessary, I'm happy to go to any of the meetings to talk about the IMA to move the process along. Just let me know how we can be of any help.
No, I appreciate that, Isabella. Thank you.
Of course. All right, Taylor, next slide. Okay, so FY25. So the Public Health Excellence Grant, the last 2 years we've had to make a annual work plan. So I sat with Michael and Taylor and Penny to look through kind of their suggested objectives, and this is how we kind of decided to plan our year. So the first 3 PHE grant requirements, we couldn't change those. Those are a requirement. So it's just, you know, the contractual requirements, executing and maintaining an IMA, and then participating in the required trainings and reviews that the state mandates. Then we needed to choose 2 sustainability objectives. So we chose communication and engagement as well as inventory management. We only needed 1, so that inventory one is kind of an extra that would really help Northborough because we have been buying so many things. So a really streamlined inventory management system would be helpful, as well as having like a form to request items and things like that, or to check out the CPR mannequins, things like that. The performance standard one, so there's 1 on inspections, there's 1 on disease control and prevention, and then performance standard 3 was a requirement if you had any towns that were not in a tobacco coalition. So Boylston and Northborough are not currently in a coalition, so that's our 3rd performance standard. And then our 2 elective work plan objectives are maternal health. So Taylor, Penny they've been working hard to kind of identify what we can do for maternal health. So whether it's home visits or workshops. And we actually have our Department of Public Health intern, Rachel. She started yesterday and she's working on a maternal and health resource guide. So that will be helpful and a key component of this objective, actually a requirement of this objective. And then elective 2 is a little bit more broad, but maintaining education, training, and credentialing for all shared staff to meet the requirements of the workforce standards. Taylor, do you have anything to add? I know you looked through the packets and very large handbooks that the state gave us.
You're on mute.
Sorry, I can't figure out how to unmute when I'm sharing my screen. So I will say that a lot of these things, it probably seems like we're already doing because we are. But we tried to pick things that we're already doing that we can improve upon, and then also pick a couple things that we don't have. So yeah, if anybody has any questions about how we kind of got there.
Any questions or objectives that you want us to focus on? Again, these are just kind of, I don't want to say the bare minimum, but what we are required to do for the state. If there's other goals and objectives that we want to work on as a collaborative, that is totally fine as well. This is just
I just
what
have a
we
question.
Yeah.
How did that conversation come about between the 3 of you rather than the group?
So really, it was between shared staff. So it was me, Penny, and Michael. Taylor, I just was helping with the nursing objectives. So that's what we did in the past. It was the shared service coordinator, the shared agent, and the shared nurse. But I'm happy I can send out the packet of example objectives and activities. And we just need to submit this by either, I think it's tomorrow, so I can send that over if people want to review and see if there's any suggestions or changes.
I would like to see what our options are.
Yeah, absolutely.
And can we get a copy of these slides as well?
Yeah, absolutely. Any other questions? All right, Taylor, if you want to go to the budget. All right, so I've been working on the budget for a couple weeks. So our 460 number, that's staying the same. So this was the same for FY24. So this first slide is all of the program staff. So we have the full-time shared service coordinator, the full-time health agent, which Northborough covers 13,000 of that salary as an effort to not supplant because we already have that in our Board of Health funds, a full-time public health nurse, a part-time epidemiologist, and then we have the same as FY24, per diem public health staff. So that's Scott Moles to do any backup Title V housing and food inspection at a per diem rate. Any questions about staffing? And then fringe benefits. I'm working with our finance department to get an estimate. There's a whole calculation to see if people would do like family or individual plans, but right now we're basing that around $25,000 for all full-time staff.
And you have a note here on fringe benefits. So I assume you have fringe benefits for all of these employees other than the epidemiologists and the other public health
Yep.
staff.
Yep. So FY24, we estimated at $25,000. I'm waiting for our team to get an updated number, but that should be all of the things will total 460 with that $25,000.
Okay.
And
Per
that's
person.
including.
That's
So
per-
is this
It's in
health
total.
agent included over what, Michael? So we're adding another?
Nope. So this is Michael.
Oh, okay.
but we're bringing the public health nurse in-house,
Exactly.
right? So we're switching from Salmon. Okay,
Well, Taylor, can you go to the next slide?
sorry.
So the consultant in this line item, so that's that reduced Salmon VNA contract to cover 1.5 and per diem hours for our CPR trainings, vaccine clinics, things like that. The new addition is this Clear Path hoarding contract, which we can discuss. So that would be a regional hoarding contract. They can offer training, case management, and consults for our 4 towns. So that is like the only other kind of additional staffing.
Do they actually go into the homes or no?
They can do consults, they wouldn't do the full cleanup. But they would be there, that, referral system, case management. And then there's always opportunities to add on. So this $10,000 contract wouldn't cover all of that. But if funds were available, we could increase that.
So Jen, you're thinking, like, this was one area I think that you had mentioned that your staff, you're understaffed on, is that right?
Yes.
And it's the actual cleaning out that.
Yeah.
Okay. So if we have, and Isabel, I don't want to put words in your mouth, but I just want to make sure I understand. So this Clear Path hoarding company has a menu of services, and we're essentially contracting with them to do case management.
It's basically so our towns have a contract with ClearPath so that when we need services, we are already part of their contract. Like right now, Northborough has a hoarding situation that we wanted to use their services, but we're not a member of them.
Okay.
So we couldn't. And if we did, it was increased rates. So after this meeting, or right now, if I can find it, I'll send that scope of services as well. And that's the same company doing that hoarding training on the 27th too.
Okay. So by having a relationship with them already, then it's really about the funding of adding on services versus going through and having to try to find somebody to help us.
Right. Exactly.
Okay.
So I can leave that kind of in the air until I send over the scope of services and we can look at that. But I mean, as you can see, there's really not a whole lot of room for wiggle room with all of our staffing. So obviously these other items are the same as what they have been: health communication, supplies, fees, other supplies, hardware, software, training, travel, office supplies. So these are fairly low items besides the software. So that's our relevant inspectional software. That's all staying the same, and we've added pools for all the towns besides Boylston, obviously, because you guys don't have pools. But that went up because we were in a 3-year contract. So FY25 is our kind of new 3-year contract rate.
Do you mind going back to the prior slide for a second? So I just have I guess it's a question, not a concern, on the fringe benefits of 25,000 for 3 full-time people, I think is low.
Yeah, so Lisa does it. They have a whole calculation. That's what we did this year, and we were totally fine. But I will have them redo it and estimate it out.
Okay, because we don't know who we're hiring for the shared service coordinator.
Right.
Or the public health nurse. So I think we have 2 unknowns there, and obviously depending on plans, that can vary greatly. So I'm just speaking from a pure Southborough side, when we're calculating out an estimate for a new hire, we go to the highest amount, which is 25,000.
The family. Okay.
So
yeah,
I just want to make sure that we're not underestimating this and then creating an issue in the future. I understand what our actual was last year, but we're going to have 2 out of 3 different people in those roles.
Yep.
I also have a question about the other public health staff. So it's per diem, but we only have budgeted $2,500.
So this year we only used like less than $1,000 of.
Right, so one of my requests was that, because we didn't we got software and a nurse last, we didn't really utilize any of the other benefits the last 3 years. So one of my requests was to have someone for housing, and also to do our follow-up retail inspections for the re-inspections. So that's where my concern is.
So would you want to add like a part-time inspector?
I don't think per diem is terrible, but I don't think $2,500 will cover that at all. For what, I mean.
Okay. Are there any other?
Because if I'm going to start using it when I haven't in the past, it's definitely going to increase.
Right. So I can play around with this and increase that line item. Taylor, can you go to the next slide? I mean, if we don't think the ClearPath hoarding contract would be beneficial this time, we could add the 10,000 to the per diem inspector line item.
Well, I think all towns have hoarding, so I think it's definitely an area that we should be utilizing. I'm not sure what else.
So Isabella, how does the hoarding contract work? Do we pay for the number of hours that we use from them?
So it's 5 hours a week that we have.
And what if we don't use the 5?
I mean, it's a contract, so.
Okay. Okay. So that's a set amount. The 10,000. I'm just trying to think, like, if, to Jen's point, I think it makes sense to go with this because it's going to benefit all towns. And if there was a way to kind of split that between getting extra support.
I mean, I could ask them. Originally their quote to me was 10 hours a week, so that was $20,000, and I asked them to reduce it. I could ask them to reduce it again. And again, it also depends when we start hiring these staff. If it's for a few months, we'll have some extra funds, but I can't plan on that.
Right. And so this budget is the 460,000 in total. Like you you've
Yep.
allocated for every,
Yes.
okay. I mean, is there, I don't know how, maybe I should know this, but I actually don't. So when the state's allocating us funds, so we got the same amount as last year, which didn't factor in any increase for employees. Like, I think that's problematic that there was no consideration of that. And clearly we have systems and structures in place already that have worked for 3 years. And I think we've worked as a team to tweak some of that. And that's what's in front of us today. But I think, is there an opportunity for us to go back to the state and say, we really appreciate you giving us level funded, but we're actually looking for more level service and want to expand based on, I think Jen can probably articulate it better than I can. But is there an opportunity for us to go back and say, we still have a gap here, and we really would be looking for an extra, I don't know, 15,000 to be able to cover that gap?
Yeah.
That was
I've
probably
asked,
a question,
the
but
contracts are set. I can ask again. I totally understand the COLA increases. I mean, the first year we had $300,000, then they added 160. So they're pretty impressed that they could keep it level funded. So I
Okay.
really don't think there's any wiggle room. The only thing I could do is talk to Hillary Johnson for the contact tracing fund. So we still have, I'd have to double check the spreadsheet. We could move one of the Salmon VNA contracts to that grant. I would just have to confirm that it would be allowable, and then that 65K would open up some space for more inspections. I would just need a lot more approval and work on my end, but I could try to see if that would be approved. The only thing, the contact tracing grant will expire in the middle of FY26.
Okay, so you essentially have a year and a half
Yes.
left of that.
Mhm.
So if we don't get an increase next year, then we have a deficit of funds
Yes.
going into FY26.
Mhm.
Sorry, Jen, I didn't mean to steal
No,
your
no.
thunder.
No, you did that
So
well.
the brainstorming is helpful.
I'm
I've
just trying
stared
to
at this
think
for
of, and this may not be an appropriate time to discuss this, but Jed, I think it's important that you know that Northborough and Southborough are looking to hire a shared inspector between the two towns from our town budgets, and having nothing to do with this PHE grant. And we've never done a shared employee outside of this relationship before for any town department. But we are trying to think outside the box, but it is our funds that are paying for it. So just keep that in mind as we kind of talk through this, that we still have to figure out the funding piece, but that we are looking to add one between the two towns, and have been talking about the fact that we would be open to Boylston and Westboro if that comes to fruition, to be able to utilize this person. We just need to figure out the funding piece. So it may not just be that one part-time inspector, even though it's on our town budgets. I hope that makes sense.
And that might open up some time for Michael as well, I would assume.
Right. Potentially. Yeah. And I know that doesn't have directly to do with Greater Boroughs and the PHE grant, but I think it's important to know that we're going down that road. It's not going to be July 1 though.
Thank you for letting me know.
No problem.
So would the group be interested in moving that Salmon VNA contract over to the contact tracing grant?
Yes.
So I think we should find out if we can. My only concern is what we're going to do next year if we don't get an increase, and I just think we need to be mindful of that. And maybe what happens is we add we add money to that part-time inspector, it goes really well, and we're not happy with the hoarding contract, right? So like, I think we just need to understand that something may have to give a year from now, but I think it makes sense to try to do it for this year and see what works.
Okay, so then Jen, so if we have that open, say 65K, would you recommend a full-time inspector, a part-time inspector?
Well, I think that everyone can, I think if you are looking at hiring staff amongst yourself, this is only going to, I think everyone could add more to what they have, even if you do hire a full-time or part-time person. So I think that would work and is a great idea if we can do it.
Okay, I will.
But Jen, are you thinking an actual, are you ad hoc or like per diem person that you use when you need them? Or are you actually thinking of like a set number of 15 hours a week?
That's what I proposed when we had this discussion in the beginning. I know, I mean, I haven't utilized that. I haven't utilized Michael at all. And I've stated prior that I really wanted to start utilizing that agent, that health agent.
Okay.
So I think, I mean, we could somehow make it work. So I do get a set schedule. That's only
Okay.
going to be a benefit.
I'm just trying to figure out like 65,000 for like how, and I'm just kind of going on a whim here. That sounds like a high number for maybe what you need. Like how many hours are you talking about, I guess?
Probably minimum 10. I mean,
Okay.
if we did part, or I mean, if I'm sure, I don't know. I think that if we thought outside the box, that position, if it was, we were offered, be able to offer that 65,000, we could have work for them. Because I know, I mean, I could do more than 10 if need be.
Yeah.
But
Okay.
Yeah.
Can I throw out something? I know I'm not like a
Yeah.
real member or whatever, but if we were to do like say the 10 or 15 hour person, move the salmon contract. Isabella, I guess my question is too, is like, if we had the opportunity to increase the clear path contract and it was more hours, like those two people could support each other, right? I mean, or that clear path could like kind of guide that person if they didn't have a ton of experience. And I don't know, like, because that seems to be like what is needed across at least a few towns, right? And then obviously hoarding comes up in every town, knock on wood. I just haven't had one recently. And then like to what Jen said, like, you know, supplementary other like work as needed as inspector as well. But you know, if Jen has a ton of hoarding cases, you have a hoarding case, like it sounds like, I mean, that is like a full-time job. So
Yeah, no, I guess my only concern with adding a full-time person is those fringe benefits.
Yeah.
yeah, no, I mean, I don't know that it needs to be a full-time person, and I am not the appropriate person to speak to that, right? Because I don't know what's going on in the other towns, but you know, that way. Yeah, I don't know.
I
So
agree.
part-time,
through it.
a part-time agent that would support Westboro, any additional services in our towns, and then kind of be that hoarding liaison type person. Is that what you
Right.
were saying, Taylor?
Now
Yeah.
that's
Like they
sounds
take the
good.
lead in hoarding, right? Like that would be like their quote unquote expertise.
Okay, like a housing. And what type of, Jen, what type of inspections? You said, would it be like septic, or you're covered in that?
No, we're covered in that.
Okay, all right. I just want to make sure the qualifications of the inspector.
Can I just add something else to what Taylor said? So I I think it'd be helpful to look at the menu of options from this clear path so we can
Yeah, I
see
can,
what we can add.
Do
But
you want to send it to me, Isabella, and I can pull it up here?
yeah, let me,
um, and understanding that, you know, it's a set contract for the 10 grand, assuming we agree to that. But then in addition to that, maybe we do increase the line item so that if we want to have $10,000 worth of add-on services based on those menu options, like it doesn't mean we'd have to spend it on that, but at least it's
Mhm.
available to us, and then take the rest of it and put it towards a part-time inspector. I'm just trying to figure out that, and Jed, I don't, like Taylor, I'm not familiar exactly with what you see on a day-to-day basis, but with that, maybe that combination, and if we actually increase the budget to have that available.
Well, I don't think we can increase the budget, right? We just
Right,
have to
increase
look at
that
it.
line item,
Right,
not have the 65,000 be for the part-time
Right,
inspector, but
okay.
have, like, take some away from the salmon amount, and then have the remainder be for the part-time. Assuming we can find somebody.
yeah. Does that
But-
sound like what you're wanting, Jen?
Yeah, and I mean, for sure. I also, I mean, would still like that, you know, a couple hour a week food inspector as well. So
Right.
I don't, and nursing, obviously. So I
Yeah.
just, that's been my wants. I'm just, other than that, I think everything's fine. I definitely don't think that we should touch the fringe benefits for that position as well. I'm sure we can work something out. I think that there's so many courting cases that we're not aware of in each town that it's a problem and it's a huge safety.
it's also very time
Issue.
consuming.
Right.
So
Yeah.
I
Oh,
totally,
so time consuming,
yeah.
right?
I mean,
So
I
it's
can just
it's
tell you,
very
like,
important to have.
my next door neighbor is absolutely a hoarder, and
Yeah, right? It's
Yeah.
it's everywhere. It's crazy.
So I guess my next step, so I'll reach out to Biddles, who handles the contact tracing grant. I'll see if they would take on that nursing contract, which I'm hopeful they would, because it's mostly case investigation that they're trying to expand. I will set up a meeting with Lynn. Lynn from ClearPath, does anyone want to join that meeting? Just so we can kind of talk about what this $10,000 contract would give us, and then what is the opportunity for, specific cleanup.
Yeah, I would love to be in that.
Okay, so I'll follow up with Lynn and Jen, and
And just to be clear, I won't join because then you'll have a quorum, so I don't want to create
thank you.
that. But so that's fine with me.
Okay, thank you.
But you know what? You can always email us questions.
Sure.
Yeah,
Yeah.
yes. And then
let me just pull up the.
try to add in that part-time agent, and we'll keep it broad, so they'll be able to have the training to do food, housing, whatever else comes up.
Perfect.
And maybe that will also help Boylston and Northborough, because we don't currently have the tobacco collaborative, so that would help us too if Michael couldn't do all of the tobacco inspections. So then it's more of a shared position. Does that sound like 3 good next steps? I will send out the handbook that the state gave us about objectives as well as allowable expenses. I'll send out the clear path kind of menu of services and their proposal. Anything else people are looking for?
I think we just another thought on the part-time inspector. I think we need to be careful on a year from now. I'm going to say it again, right? So that we're not in a position where we've hired somebody onto a personnel plan and have a financial commitment that we can't pay for. And I don't know what the salmon contracts, how many years are the salmon contracts?
Just yearly.
They're yearly, okay.
Yeah.
But I also don't want to, I think nursing is also very important here too. So just because we're moving it over, I don't think that we're committing to not moving it back over, right? So I just think we need to be careful about how we go about hiring a part-time or a per diem. I would rather do a per diem because I think that is easier it's more flexible.
Okay, I can talk to our administration too to get there.
I think per diem would be great. However, I think they also, I mean, usually you pay more for that kind of staff for hourly
Totally
rate.
agree. Yep.
So I think that's something that should be looked at as well.
I think the other thing with per diem, when you have like a active hoarding case, just food for thought, is like we're kind of at that person's mercy for how many hours they're going to commit to us, because we're saying you can work when we need you, but also you don't have to work. Like that's also a benefit of being per diem, is like you work when you can.
Yeah.
So if we have a housing, if Jen or me has a housing case that is really time consuming and that person can't commit hours, just food for thought too, that could be problematic.
Isabella, do
And
you
then
have the label?
sorry.
Your
And
label.
then
Oh, sorry.
sorry.
Go ahead.
Go ahead, Chelsea.
I was just going to ask if Isabella has access to her labor council to talk through these things. I think that's an important perspective to have.
Yeah, I can do that.
Sorry,
And I think that we know that hoarding takes so long, and then the per diem rate, I think it's just going to be too much. I don't think it would fall in our budget that way either.
I think per diem is great, but I don't know for this.
Right,
Like,
exactly.
if it was for follow-up inspections and like septic only,
right,
then it could probably work.
And I don't disagree with you. I'm just worried about
I know.
here a year from now.
I
And
hear you.
Like we're like, okay, so we have nursing and we have inspections. Like, what do we pick?
Right.
Like we're just at the mercy of the state from a financial perspective. So that's what my concern is. I think all your points are very valid.
And yours as well.
Thanks.
Well, I'll do some digging. I'll talk to town council and admin, and I'll schedule a meeting with the state and see what their suggestions are. I can share our, goals, but also our kind of gaps right now and see what they recommend. Anything else about FY25?
When does this have to be finalized by?
It was due yesterday, but I got an extension because I wanted to talk to you all first.
We should probably schedule another meeting before our next meeting, I would assume, right? To discuss.
Yeah.
So the final is due June 28th. So if we could schedule another meeting in the next week or two, that would be helpful for me.
Okay.
So if we actually just want to look at our calendars now, that would be helpful. So does anyone have any availability Monday or Tuesday, June 24th, June 25th? That would give us 2 weeks. Me 2 weeks.
I have Monday available. Anne Marie.
I could do Monday just after 9:30. Before 2:30.
I could do that as well.
All right, you want to say 10 on Monday the 24th?
Sure.
Sure.
I will send out a calendar invite and a Zoom link. All right, Taylor, if you want to just go to that next slide. Last slide. The next one, sorry. Okay. So as we all know, we're at the end of the fiscal year, so trying to spend down all of our funds. So we're doing good relative to other groups. So we have about less than $30,000 to spend. So we can continue spending. Unfortunately, some of that money might get turned back to the state. These are the spending items and categories that I have really pushed the last month. If you asked me over a month ago, we probably had over $120,000 to spend.
Good job.
It's hard to spend money. I don't like this.
It is.
So, I'm not going to read through all of these different line items, but if you have any ideas, please send them this week. I will try my best to confirm if they're allowable. That has been a process in itself. But the main things, so we did that opioid settlement strategic plan. So that presentation is at the end of the month. We got over, I think, 10 interviews between the 4 towns, recovery centers, youth. So I'm really excited about how that process has gone, especially in that short timeline we had. The other thing about allowable expenses, the MHOA conference for November, the early bird special or whatever registration started yesterday. So I have registered me and Michael, so feel free to let me know if you want to join. I just need to do that really by this week. And if you had previously emailed, you can actually go ahead and sign that up and then forward me the invoice. And Northborough will cut that check. And those registrations, it's about $550, I think, per person.
So is the courting training or meeting we're having, is that costing us money with them?
Only $400.
So is that part of this, or did you put it?
Yep, no, this is part of it. That's under trainings, that hoarding webinar.
Oh, I'm sorry, I didn't see that.
No, that's okay.
If we're gonna try to get more money and eventually even next year, I don't want to give any back. So how do we brainstorm more? I mean, Isabella, you did a great job, but how do we brainstorm more how much did you say we have left, around 30 grand?
Probably 30. I still need that final fringe benefits for this year as well, but around there.
Did we look into the electronic filing?
Yeah, so
Ridiculous
Southborough
amount
kind
of
of took the lead on that. Northborough was nowhere near ready to do that. Chelsea, if you want to update, I mean, it's a big.
I'm very frustrated.
I can speak on it if you want.
Go ahead, Taylor. Yeah, you can do it. Sorry.
So we put in a request. So all of our background for Southborough, all of our records are already online. Our admin has, over the past 5 years, been scanning everything as she has time, but they're not viewable to the public. So we use OpenGov. I don't know what you guys use, probably something similar, just to get a quote for the scope of work from them. Long story short is that they completely failed us and did not give us what we wanted. And now it is June 11th. They want to meet again and stopped responding to us. And it's not going to happen for us this year, unfortunately, which is really disappointing because it would have taken up a huge amount of money for us. But I am extremely frustrated with how the process has gone with them, and the scope that they sent us was completely incorrect. So it's not even worth sending to you guys to look at.
You don't even want to talk. You don't want to deal with them when they've screwed up so badly.
Exactly. And you would think they would know how to work with municipalities and timelines and understand that. No. So the scope that they gave us wouldn't be approved through Greater Boroughs because it's not even what we asked for.
So we ran out of time, essentially, because
and then the reason that's not we have a tight budget already, but they have a kind of new rule that you can only use consultant, or you could only use that project. It's like 10% of the funds. So it wouldn't have been enough anyways for all of us, or probably any of us, to do that project, unfortunately. That food resource guide our intern worked on last year. I have been working on finalizing it a year later, but I'm getting that printed, and I'm also in conversation with MHOA to see if we can get that translated. So that was a Greater Boroughs food resource guide. So we'll have printed guides as well as the postcards, and it's available online. So if I can get a quote for that translated, that would be.
For the postcards, would it be an allowable expense to send them to every house in town?
I was just going to say that.
Yeah.
I can ask.
Okay.
I was just going to say that. That was
Printing
good.
them absolutely would. we already have like health communication, we can print whatever we want.
Yeah.
I would have to ask about the postage and,
Mailing.
and that, yeah.
Because if it's a
I mean, I know
postcard,
it's
we
not
get
that
10
much.
off. Oh, sorry, Jen.
I'm sorry. I know it's not that much. I think we just did a mailing in Westboro for every household. Like it's about 2,200, I mean, 22,000 people. It was like 250. It was ridiculously cheap.
$250?
Yeah, it was ridiculously cheap.
Oh, I feel like last time I got a quote, maybe I'm just getting ripped off. I think it was like $1,000 for like 300 households. So maybe it was something bigger now. I can't remember, but okay. I mean, that's still between the 4 towns, maybe like $1,000.
Yeah.
Yeah, that's
I mean, it's a
good.
good idea
That's-
too, because
yeah,
the postcard
absolutely.
has, I can share it around. It has obviously the QR code, but then it has a little spiel, short sentence about what Greater Boroughs is. So it's also branding, but communication. So that's how it's an allowable expense, is we're giving out resources. So I guess it's like a dual benefit. Does anyone else have like items that they need translated? That was in our work plan, so I want to make sure we're also connecting our work plan to our funds.
I would say like someone at some point, I think, and it wasn't in this group, but maybe someone that I talked to said that they got translation services for like all of their social media posts that they were posting. So they posted in like English and Spanish and Chinese or Portuguese. I don't know.
And we don't really have like posts made.
It'd kind of be like on the fly. I know what
Right.
we would have
What
to
about the just the Greater Boroughs website, everything on there?
Yeah, so I think Kristen, like years ago, or maybe 2 years ago, included in the budget a website consultant or something like that, a graphic designer. But unfortunately, Northborough is still waiting for that Civic Plus kind of remodel. So they want it to stay on the Northborough page. So I don't know exactly. I can ask IT, but I'm not sure how that would work because it's not like a Squarespace or a different website.
Yeah, I think I was talking to someone has a really nice website. I'm like, oh, why can't we do that?
I'm out of ideas. All my ideas got rejected, so.
Yeah, Chelsea fought hard. She asked for AED machines for all of our parks. And it was actually Southborough already has them, so she was looking out for the rest of our towns, but that was denied. Also, I think I talked to you, Jen, and Chelsea, but all of our like free giveaways that we may have bought in the past, that's no longer an allowable expense. So I can't even buy, like a bunch of hand sanitizers or something like that. Because I asked for like mini first aid kits. I thought that would be good.
What about more signs and sunscreen stuff?
So I don't know if Greater Boroughs never paid for that. They never approved that. I think you use Metro West funds and we use Be Well funds.
Yeah, you're right.
Yeah, we use COVID money.
So Jed, I completely agree with you, that I don't want to return the funds, but like, if they're not going to approve what we think we need and what's appropriate, it's hard. I mean, Isabel has worked so hard on trying to get stuff approved. And I feel like I've taken some frustration in Isabella because I'm like, what do you mean they rejected it? So I hear you. I don't know. I mean, yeah, could we just spend more money on nursing supplies? Yeah, but that's not really what we need, right? Like we have the list there.
Expire, that's the other problem.
Right. So it would be wasteful to do that.
What'd you say, Taylor?
I said it's like nursing supplies like end up expiring also.
Oh, right.
Which is frustrating too. What the other thought that I had too is like I had talked to Jim. We have a freezer that we don't use, and I was going to give it to him, but maybe just put in for a freezer.
Oh, yeah, that was the plan. Because he said that, and he's like, Taylor's gonna freeze it for you. I'm like, but we need to spend money.
Yeah, so maybe just do that.
Yeah. All right, I'll ask Jim. I think I do have that link. I just need to make sure that it would be shipped before the end of the month.
We also bought epinephrine.
Oh, yes. EpiPens. So we got, I think our approved rate was $4,500. So we got 12 adult and 12 pediatric doses.
to split across.
Yep, so those will go to the towns. That was a helpful actually expense because they're no longer giving those out for free at the nursing conference.
Is that before or after the 30?
It's included. I did it. I redid the numbers this morning and I was trying to like think of everything that I could possibly think of.
We also tried to get more than that and we're essentially told no, so.
Yeah. While I'm budgeting, does anyone else think they're going to MHOA? Because that's a pretty hefty conference fee as well.
We're gonna go to Miha.
Okay.
Is it the same time?
No, I think it's in October or November.
Oh,
Did you already register?
No, not yet, but that's where we decided to go.
Is there an
if
early
you can
bird?
do it, we can spend that money through.
Only if there's an early bird registration. They were very strict about
Oh.
the difference.
I don't know if there is.
I think I got a notification about that.
So what if you can only go to a day of MHOA?
They have day rates.
And what
Just
if you,
not the early bird?
so what, okay, so let's say I can go for a day, I'm just gonna pay the early bird rate and then just go to the day I can go?
Yeah, I mean, they don't care.
You could try to go to the other days, and if not, that is
Right, I mean, well,
just let me
I
know.
think, Chelsea, it would be very beneficial for someone from the board to go personally.
okay.
Nancy used to go and I think so did what's her name?
Mary Lou.
Yeah.
All right, so I'll send it to my board too, Isabella, but you can mark me down for that.
Okay.
Isabella, Anne Marie, I will go as well.
Are
the
either of
full
you an
3 weeks.
MHOA member?
No,
I am.
All right, so to do the early bird special, you have to be an MHOA member, which we can cover, which is fine, but you would
okay,
just
how much
need
does that cost?
Like $100
not much.
I'm just kidding.
Sign all our boards
that was
up.
actually the other thing I was gonna say. If anybody needs to renew any memberships, like a lot of them expire July 1st. We can renew those with this money as
So
well.
I did like Taylor, Jim, and Penny's MAPHN. I did Michael's, I don't know, something. We're trying to stay on top of those as well. Any like textbooks, like I got Michael an RS textbook. There's a certified health officer textbook. Taylor, Maria, if you're
I would take
interested in
CHO
textbooks.
textbook. I already have the RS one.
Any trainings, we could look into if they're virtual self-paced, we could sign up for trainings that staff could do. So I think one region did a health literacy webinar, self-paced. So if there's any trainings you're interested in, we could look into that. It would
When
just
do we have to get this, like, if we're racking our brains more, is there a list to look at?
yeah, so I've definitely sent it. It's if you search in your inbox allowable expense, I can send it again.
Oh, yes, I remember seeing that, sorry.
No, that's okay.
When do we need
It's
to,
not a
like,
super
when is,
helpful list, Jen.
what?
It's not a super helpful list at this point.
I feel like I have it memorized almost.
When, I would assume you need it sooner rather than later because of the timeline.
Yeah, no, I mean,
This-
June 30th is our last. Everything needs to be in our hands.
All right.
And then,
And
I
we
mean, one of
looked at-
the helpful allowable expenses, I talked to our IT director and he was like, actually, like all the shared service staff need new computers. So that was like almost $9,000. So that was a helpful expense. And we also got some for the positions that we're hiring. So that was good.
And that's only for shared
It
staff,
is
right?
shared staff, yeah.
Is
Even
cell phone
like
part of that?
like a new keyboard, things like that, that would be for shared staff only.
Yes.
Okay.
And are they providing cell phones?
So it depends on the shared staff. Like I had a phone. Michael doesn't want a phone. And then Penny has her Salmon VNA phone. So it would
What about like a air card, or because
A
those
what,
cost
sorry?
a lot of money.
What's
Like it's
that?
what is it, a Wi-Fi card where you can get Wi-Fi wherever you are?
Oh,
so the
hotspot.
iPads I think have service. I can ask about like the Wi-Fi, like
Hotspot.
hotspots. But I think that's a yearly contract, so I don't know if that would
Yeah.
help us in the future.
Well, I
We
have
have-
a device that you just plug it. We don't pay anything for. No, you're right. It is. It's a monthly cost.
It's monthly.
Through the
Yeah, that's
phone.
what mine is
Yeah,
too.
you're right. Um,
And I know another thing I was looking at the translator devices, but I know Southborough, Northborough, we're getting it from FEP, Westborough.
I am too.
Okay.
Yeah.
All right.
But at this point, I mean, we've been talking
I don't
about
think
it for
that-
over a year, so I don't know.
Oh,
I mean, maybe we could just get extras. I don't know. I just.
well,
Anything that, Jen, that you guys need for like inspections, like hoarding inspections or anything like that? That's not on this list?
Yeah, I think Isabel and I talked about.
yeah. So I did make, they're actually on the, I'll get it.
I'm just trying to think of things like
No, I get it.
on the fly.
I'm thinking
I
of
made
maybe going to look
everyone-
at.
I made every town an inspection bag, and it has a
Oh,
bunch
look at
of
you.
requirements that we talked about, like moisture meter and light measure and these little things. And I don't know. So every town has one of those, so we can be handing those out. Westboro did get a portable fridge freezer, which is sitting in my office. And then the LL Bean stuff, hopefully, will be here this week or next week.
Actually, I remember you saying that the noise
Yes,
monitor was really expensive.
I bought them.
How many?
I think I bought 3 or 4.
Is there a reason why we can't buy more than that? Because I mean, we have more staff than that.
So the thing about like big supplies like that, they want it to be like regional. So I don't know per staff they would be okay with that, but I know Taylor, I'm still my Amazon, I have like spent too much money, so my credit is I need to figure that out. But I know Taylor, you had requested what are those hard totes or what is it
Oh,
called?
Pelican cases
Yeah.
for vaccine clinic. So I don't know if you've ever been to one of the clinics that Jen, did you ever go to the clinics when we had them in the regional site?
No.
Okay. Basically that's what we use to carry things back and forth with. There's the like huge hard-sided Pelican cases in Northborough, I think is the ownership of them, but I got two of those just to carry supplies. So it's essentially like a suitcase to roll supplies around, like travel with.
Well, Jim does a lot of things at senior center, so if you think he could benefit from one, you could add that.
Okay.
I don't know how much
I mean,
they
they're like
are.
$300 each. Anne Marie, anything you can think of?
No, I'm all set, Isabella. Thank you.
I feel like we could do more with the translation. I do. I just not sure where. Because I know
so
it's,
I'm really excited about that food resource guide. So I'm just waiting for MHOA. They had helped me with translation of our resource guide, our Northborough resource guide, and they actually had funds to do it. But I asked them if they could translate the food resource guide, and we could do 5 different languages. If there's any other documents that you want, you can just send them my way. The website, I don't know if we could really get that, but we could do like our pamphlets for substance use resources, like in the Narcan kits, and then maybe like the home wellness checks.
I was gonna say, what about the home wellness checks? Yeah.
I guess my only concern though is none of our nurses,
How would they?
right?
the
It's like we're
nurses,
offering the
yeah.
service, but then
Yeah, I wouldn't do those. Yeah, you're right.
unless those translation devices are really good. I've never used one.
No, I don't
Pocket
know.
Talks. I don't know if that's what they're called.
I don't know what they're like.
I've heard mixed reviews,
Isabella,
honestly.
Yeah.
question. Do we have opioid overdose rescue kits?
Yes.
What
Narcan
do you
kits.
mean by like Narcan kits?
They're called sandboxes. Um,
Are those the ones that go outside, like kind of an AED machine?
Yes, they look just like that.
Oh, so
I don't know if that's something that we have that you might want to consider, or it might even fall under the opioid settlement
that's what
funding,
South
but
Borough is planning to use some of their money for, but
Oh, you guys are looking to buy those?
with opioid settlement funds, that was kind of on our list, but if we need to spend down this money.
Okay, I can ask our program coordinator. Yeah, I have seen these. They also come with like a rescue breather thing.
There's a different brand that we were looking at, but
Okay.
same idea.
I know MHOA has been talking about them.
Yeah.
You have the lead determinator class in there?
In this year, this
Yeah.
budget is the class
For next 2025. Maybe
Wait, so
that's
like-
something that could be covered.
Oh, for this fiscal year?
Next
No,
fiscal year.
oh, that's right, we're talking about this fiscal year. I'm confusing myself.
And I have met with a couple other regions to see if they had any good ideas, and they're kind of all in the same predicament. And that is why if you look at next year's budget, most of our money is going to staffing or a contract. And I think that's what we need to do because we don't need to be in the situation for previous or for future years. So if we can have that allocated to actual like people power and sustainability, that would be a lot easier. Well, if you have any
I
ideas,
think you could order us a RS book and a certified health officer book.
perfect. I'll just redo those orders.
The other thing too, MHOA is advertising for the RS class that's on your own pace, if you guys are interested in that. I know I got one of those. It's like a 40-hour class that you do on your own time.
Did we cover that, Taylor?
I think so.
Okay.
I'll check with Barbara, but
Yeah, just double check. I mean,
Okay.
it's allowable. I just want to make sure.
I thought that MHOA was covering that.
it's like a reduced rate through MHOA. So
Oh,
yeah. So I think it's this originally like a $750 class, and you can get it through MHOA for like $490 or something.
I misspoke, we're going to the Yankee conference.
Oh yeah.
Where is that?
Mystic.
Oh,
It was supposed to be in Vermont, that's why we actually decided to put it in my budget to do that.
Mm.
But they changed it, so we were super bummed.
and I did ask for the MHOA. We can't cover the hotel charges until next year because the conference is next year. And so Taylor and Chelsea had requested a large printer scanner. I had asked and I emailed them again today. So if that's approved, I can let everyone know. I don't know if that's a need in any other towns. It's not in Northborough.
A portable one, I think would be super helpful for you people that do off-site immunization clinics.
A portable, say that again,
Scanner printer,
like a small one.
yeah. I know Jim could use one when he goes to the senior center. I mean, it's not a huge need, but if we're
Mhm.
trying to.
I mean, Jim actually at a nursing meeting like a couple months ago, Taylor, he requested that a big scale and it was like over $1,000. So we weren't sure at the time, but
Oh yeah, that's right. He wanted that.
it was like was it a
scale.
roll-on scale?
Yeah, roll on, walk on scale for people who weren't able to just step
Yeah.
on it.
We wouldn't have room in Northborough, but I can certainly look into that for Westborough.
I think he wanted it for the senior center, so
Yeah, okay.
yeah, put that in, see what happens. It is nursing supplies.
It is, no, it absolutely is. Well, I really do I feel like this was a good brainstorming session. I will do all the things I said. And we'll meet on, what day was that? On Monday in 2 weeks. In the meantime, I will send everyone the FY 2024 allowable expenses, the clear path, kind of menu. Jen, I'll set up a meeting for me and you and Lynn. I'll talk to Biddles to see about that contact tracing grant and just think about how we could do per diem versus part-time for the agent. Yeah, I'll have to rewatch this video.
I think you got everything.
Yeah, I'm
Oh,
trying.
send the slides out.
Yes, send the slides out. And yeah. Anything else people can think of?
No, just thank you for all your work on this. I know it's
Yeah, for sure.
not
Thank you.
straightforward and
Oh, I'm very excited to hire a full-time shared service coordinator.
I
I
am
love doing
sure
this
you
work and
are.
I love you all, but wow, I could use another person. No, but I appreciate you all. I guess if anyone wants to adjourn the meeting and then we'll follow up in those 2 weeks. Feel free, please email me if you can think of any, even something little that you need. We can get that ordered and all set.
Great.
I moved to adjourn at 11:07.
Second.
All those in favor?
Aye.
Aye.
You'll say aye.
Boylston,
Aye.
Westboro,
Aye.
Southborough,
Aye.
and Northborough. Aye. Well, thank you so much. And Anne Marie, I know you just sent me an email, but Select Board of Health, vote on the IMA. Jen, I know yours is scheduled for the end of the month. And then Lisa, we're just re-voting just because a couple things changed, but we'll get that all signed and get your one town page signed and then I can pick them up. So we have all those wet signatures.
Awesome. Thank you.
Right.